and welcome to today's live chapter reading of Unbreakable by T. Smith, as brought to you by Itsy Bitsy Book Bits. Chapter 1. Sir, I need you to fill out this paperwork. Fill out your own paperwork. I need to see the nurse. Have you been here before? I need to check your records. For fuck's sake, can't you see I'm bleeding here? I need to see a nurse. But sir, is everything okay in here? Aaron asked, hearing the commotion in the reception area. Behind the counter was an obviously distressed man. The rag held to his left shoulder was red with blood. His eyes widened as he took her in. Are you the nurse? He asked. I am. What's up? I'm bleeding. I need stitching. I can see that, she admitted, moving around the counter to take a look. Come into the treatment room and let me see what we're dealing with. He needs to fill out the paperwork. Ashley rolled her eyes as she held the clipboard out over the barrier. Give it to me. I'll sort it. Aaron took the clipboard from the receptionist and ushered the man into the treatment room. I'm Aaron. What's your name? She asked, taking a moment to assess him from head to toe. He was tall and handsome with warm-colored skin, short, shaggy, dark hair, and brown eyes. He looked her age, but she'd never been great with guessing people's ages. Ripper, the man ground out. Ripper, she raised a brow. Is that your first or last name? Just Ripper. Okay, Mr. Ripper. We will need your details before you leave, but right now, can I take a look at your wound? She slipped on a pair of gloves and carefully peeled the rag away from Ripper's shoulder. Can you take this off, or can I cut it? She asked, tugging on his shirt. Wincing, he unbuttoned and slipped the shirt over his shoulder, revealing a 5-inch gash extending from the tip of his shoulder toward his chest. It was immediately apparent to Aaron that he indeed needed stitches, and possibly more. I think this might need looking at by the doctor, she advised, leaning in closer to gain a better look. You might need to pop over to the hospital and have it assessed by plastics. I can call ahead for you if you like, so you won't have to wait for hours. Just stitch it, Ripper snapped. It will leave a scar. Ripper laughed a dry, humorless laugh. Ha, what's a few more scars, darling? It's pretty deep. You're gonna need some antibiotics and a tetanus shot. Who cut you? Does it matter? No, she sighed. It doesn't matter, and it's none of my business. I'm just concerned what you might have been exposed to is all. She tried to explain. Can you fix me or not? Ripper's eyes bore into hers. Yeah, it's going to hurt though. I need to clean it up before I start, and then I'm going to give you some local anesthetic to numb the area so I can stitch it. No drugs. He shook his head from side to side. It's just a local, she explained. It will just go under the skin and numb the area so you won't feel the stitches going in. It will give you a bit of pain relief to the area, but only for a little while until it wears off. I said no drugs. She raised an eyebrow in surprise. He didn't look like the sort to be scared of needles. It won't hurt as much with the drugs as it will without. No drugs, he repeated. Okay. Squeezing the plastic bottle, Ripper let out a hiss as she poured saline directly into the open wound before wiping away the bloody mess with a wad of gauze. As she worked, she scanned the tattoos she could see trailing down his arm and chest, looking for gang insignia. Rosewood Bay was home to 2 well-known street gangs, the Rats and the Hawks. Each said they stayed out of the other's way, but the time she spent patching them up after their scuffles told her otherwise. Friendly fire, her doc called it. Just what boys do. It hadn't always been that way. In the early days, the Hawks had run the streets. They'd had no competition. It had only been during her teenage years. She remembered the rise of the Rats, a much younger group of boys, street kids, mostly involved in petty street crimes. This is going to hurt, she said, catching Ripper's eye. You can change your mind about the local if you want. Just do it, he said stoically. If he was trying to impress her, it wasn't working. He sucked in a deep breath and stared at a spot just over her shoulder, while stitch after stitch pulled the wound edges together. Within a few minutes, she was applying clean dressing. You need to keep this clean. Pop back in a week to have the stitches removed. Take it easy. Don't do anything too strenuous. If it starts hurting more or becomes red or filled with pus, you will need to see a doctor. I recommend you see a doctor anyway. It will be fine. Thank you, Nurse Aaron. He offered her a crooked half smile that she couldn't help reciprocating. He had a magnetism about him that she couldn't quite explain. You're very welcome. Now, if you could please fill in the paperwork before you go. Otherwise, I'll get into trouble. I can help you with it if you like. She was always mindful that people who refused to complete paperwork might be illiterate, especially in the Little Rosewood Bay Clinic. It operated as a drop-in clinic owned by the city council. It was run by nurses and frequented by visiting doctors, mostly young, altruistic types, hell-bent on saving the world. Excuse me. After a brief time, they usually left jaded, on to greener pastures, looking for more of the clientele they were used to. The Bay had an upper crust, like most places, but it also had a seedy side. Most locals knew the streets were not a place to be after dark. We wouldn't want you getting in any trouble now, would we, darling? Ripper offered her a full smile this time, his brown eyes flickering a twinge of yellow as he took the clipboard from her hand. She busied herself cleaning her mess while he attended to the requirements. Do you need any pain relief to take home with you? She asked. No drugs, he said again. Here. He handed her the clipboard, his hand brushing briefly against hers, causing her skin to tingle. A long moment passed between them before she shook herself out of his mesmerizing spell. Okay, you take care then. She looked down at his paperwork. Mr. Bandura. As he walked away, she caught herself staring. What was it about this guy? The sliding doors opened and a Staffordshire Bull Terrier dog ran to his side. Aaron? Her coordinator's voice drew her attention back to the present. My office. Now. Rolling her eyes, she dutifully followed the older woman into her office. Sit, the woman said dryly, pointing to the seat on the opposite side of her desk. Erin did as she was told, looking around at the posters plastered over the old building walls. It could do with paint, she thought. Ashley told me what happened just now. You know the procedures. You've been here long enough. Every patient needs to complete the paperwork before we see them. The man was in pain. He just needed patching up. He's done the paperwork now. She held her hand out in demand, and Erin passed the woman the clipboard, which included Ripper's information and Erin's notes. The woman scanned the pages while Erin picked at a loose thread on the edge of her top. She hated the cheap mint-colored scrubs the clinics made her wear. She'd already had to resew the hems on most of them. You need to report this, she said eventually, looking up and catching Erin's eye. Pardon? It's a stabbing. If anyone presents with a stab wound, you need to report it to the police. Well, technically, she squirmed, suddenly uncomfortable with where the conversation was heading. The patient, didn't say he was stabbed. But he was. It certainly looked like a knife wound to me, yes. I told him he needed to go to the hospital, suggested he might need plastics to look at it, but he refused. Then you need to report it. But don't argue with me. We want to keep our funding, and as such, you need to abide by the protocols and rules. Do you understand me? We also have a duty to protect our patient's privacy. We don't know what happened. I asked, and he chose not to disclose. Barbara rolled her eyes and shook her head. You need to start towing the line, Erin. A program such as this only works if everyone works together and does the right thing. I understand, but we have a duty not to go against our patients' rights. Hence, everyone needs to provide their details on arrival. It says so right there in the terms and conditions that we reserve the right to report incidents to the police if we have any concerns. Barbara pointed to the fine print on the back of the intake form. No one reads that, you know. Then it's your job to make sure they do and that they understand it. I thought it was my job to take care of patients in a timely manner and educate them about health matters. She regurgitated the spiel Barbara usually gave her nursing staff. Barbara wagged a crooked finger in the air. You are walking a very thin line, Nurse Erin. Are we done? Erin asked, rising to her feet. She was finished, even if her coordinator wasn't. She understood all right, but she wasn't happy about it. For now, Barbara fumed. Erin took her exit, ignoring Ashley on her way back to the treatment room. It was lucky she loved her job so much because sometimes the people she worked with did her head in. Chapter 2. Reaching for the bottle beside his bed, Ripper took a deep swig. He should have accepted the painkillers the sexy nurse had offered him. Ah, Nurse Erin, he sighed. Zeus snorted at his side, and his wet tongue reached out and licked his arm. He dropped his hand to the dog's head and scruffed it. It's all right, boy. You did good. His mind wandered to his dog's distress earlier in the day. The whole situation was stupid, and it shouldn't have happened. He thought he'd been punched. It was quick. So quick. A flash of silver, a hit, and the mongrel had taken off into the street before he realized he was bleeding. The kid he'd helped had taken one look and hightailed it as well. So much for trying to help. Geez, he should know better by now. Ripper! The pounding on his door had him groaning as he rose from his bed. Don, he acknowledged, opening the door and allowing his boss to enter. Shit, what happened to you? Maybe you should ask that little shit Brody about that. Well, that's why I'm here. I've just got a call from Johnny. Apparently, Brody turned up, panting like a dog. Your name on his slip. What the fuck, Ripper? What are you doing getting involved in shit that has nothing to do with you? Brody got rolled. Johnny's furious. We run a tight ship. We don't need this. He waved his hands toward the dressing on Ripper's bare chest. Well, maybe you should be telling Johnny that. Not me. He shouldn't be sending a fucking 10-year-old to do his dirty work. Brody's 16 and Johnny's nephew, Rip, Don corrected. Whatever age he is, he's a fucking kid, Don. Too young to be on the streets doing jobs for Johnny. Do I need to remind you where you were at 15? At least I wasn't on the streets, he barked back. Don laughed. Ha, no, that you weren't. You were too busy being someone's little bitch. Fuck you, Ripper spat. Then taking a swig of his bottle, he slammed it down hard on his small table. A splash of the clear liquid spouted from the neck and spilt on the table, the noise causing Zeus to snort in disgust. Who is it then? Don asked, his demeanor calm and collected. Who's what? Ripper's hand went to his wound that seemed to throb as a reminder of why Don was there. Who did this? Who's causing trouble? Ripper flopped back on his bed. Do you think if I knew, they'd be walking around right now? The Hawks had run the streets of Rosewood Bay for several generations. Don had been involved with them when he was young. They had never had any competition until recently, and they were none too happy about it. The problem was, it was making the streets a dangerous place for everyone else. A lot of fighting over territory. Each thought they had more rights than the other. Typical macho shit. Shit that Ripper knew only too well and was happy to step away from. Only it seemed to keep following him around. You all right? Don asked finally, nodding to his shoulder. Just a little cut. Nothing a little Patron won't fix. Nurse reckons I need to take it easy a few days and I should be right. Hope you didn't squeal. Ripper glared at the older man until he nodded in acceptance. He should have known better than to ask. Ripper would be the last person to squeal, and he was offended that Don would even suggest it. Right, Don conceded. Get better then. He walked toward the door, turning back when he reached it. Just try to stay out of trouble. I need you. Ripper knew he did. He had been working for Don for 5 years. He knew the business inside and out, and most importantly, he knew how to keep his mouth shut. If prison had taught him anything, it was that. When he'd been released, he'd headed straight to Rosewood. One of the boys knew someone who knew someone. That turned out to be Johnny, who had quickly put him in touch with Don. Don had given him room and board in his workshop in exchange for some motor work. Ripper had picked up a few skills in prison, ones that were now useful. Many he had learned since. What he hadn't learned were street smarts. He'd had Jay for that. These days, though, Jay was playing daddy to his little girl. Her mother had died a few months earlier from a drug overdose, and it had been time for Jay to step up. Since then, Ripper mainly had kept to himself, tried to keep himself out of trouble, as Don would say. It wasn't his fault trouble seemed to follow him around. And that was the beginning of Unbreakable by T. Smith. Live chapter reading brought to you by Itsy Bitsy Book Bits. Hope you enjoyed it.